నమస్తే డాక్టర్ గారు.
నమస్కారం అండి.
Yes, sir.
థ్యాంక్ యూ అండి ఫర్ ఇన్వైటింగ్ మీ టు ఎన్టీవీ. చక్కగా చెప్పారు. మనం ఎంతసేపు షుగరు, బీపీ, కొలెస్ట్రాల్ చెక్ చేసుకుని బాగానే ఉన్నాం అనుకుంటున్నాం. కానీ ప్రతి ఇంట్లో ఇన్సులిన్ అనేది చెక్ చేసుకునే అవకాశం అవుతుందని మీ ద్వారా ఈ హోమా హెల్త్ సెంటర్ స్టార్ట్. ఇన్ దిస్ వీడియో we delve into the intricate mechanisms by which insulin regulates glucose levels at the cellular level. Insulin produced by the pancreas plays a crucial role in maintaining blood sugar balance. It binds to insulin receptors on cell membranes, initiating a cascade of signaling pathways that facilitate glucose uptake into cells. Divided by GLUT4 is a protein that acts like a gateway for glucose to enter cells. It's especially important in muscle and fat cells. Normally, GLUT4 is stored inside cells and not active on the cell surface. When insulin binds to its receptor on the cell surface, it triggers a series of events that lead to the activation of GLUT4. This activation causes GLUT4 to move from inside the cell to the cell membrane, where it can transport glucose from the bloodstream into the cell. This process is crucial for regulating blood sugar levels because it allows cells to take in glucose when it's available divided by. Divided by the PI3K pathway is a key signaling pathway that insulin activates when it binds to its receptor on cells. When insulin binds, it activates PI3K, which then triggers a cascade of signals inside the cell. One of the important effects of the PI3K pathway is the activation of GLUT4. PI3K helps to move GLUT4 containing vesicles to the cell membrane, allowing GLUT4 to transport glucose into the cell. This pathway is essential for the insulin-dependent uptake of glucose by cells, especially in muscle and fat tissues. Divided by the mTOR pathway is another important signaling pathway that plays a role in insulin and glucose metabolism. It's involved in regulating cell growth, metabolism, and protein synthesis in response to nutrient availability and growth factors like insulin. In the context of glucose metabolism, mTOR can influence how cells respond to insulin by integrating signals related to nutrient levels and energy status. This pathway helps coordinate cellular processes to ensure that cells have enough energy and resources to function properly. Divided by insulin is a hormone produced by the pancreas that regulates glucose levels in the bloodstream. When you eat carbohydrates, they are broken down into glucose, which enters the bloodstream. High levels of glucose in the blood trigger the release of insulin from the pancreas. Insulin then binds to specific receptors on cells throughout the body, including muscle, fat, and liver cells. Divided by once insulin binds to its receptor, it initiates several processes. GLUT4 activation. Insulin activates GLUT4 transporters, allowing cells to take up glucose from the bloodstream. PI3K pathway activation. Insulin activates the PI3K pathway, which helps move GLUT4 to the cell membrane for glucose uptake. mTORC pathway activation. Insulin also activates the mTOR pathway, which regulates cell growth and metabolism in response to nutrient availability. Divided by understanding these processes is crucial for managing conditions like diabetes, where problems with insulin production or sensitivity can lead to abnormal blood sugar levels and health complications.